I love it here. It's so much fun. I love coming to work in the morning, which is pretty unusual for some people, but I can honestly say that.
I'm the nursing unit manager for Leeton Aged Care. I love this role because I love aged people and I like making a difference in their life. I like to see the joy that they can experience as they interact with each other and as they enjoy participating in activities that we have here at Carramar.
So I'm a GP, VMO anaesthetist, so I work in general practice, which has all the varied nature of normal general practice in a rural town, and then I'm a VMO here at the hospitals. I mean, it's a great place to live, and I say that quite sincerely, whatever career you've got. And we've got a wide, diverse group of friends, great social life. It's been a great place for our kids to grow up.
It's a great place to work, it's very close, it's a great team environment, everyone's helpful, and you also feel part of the team. Staff are very welcoming. I've only been here recently, but everyone's been great. I enjoy living in Leeton mainly because it's nice and rural. Everybody's relaxed and friendly.
I actually work on the ward in general as well as maternity. Well, the new model of care will involve low-risk women. We're involved in their pregnancy, the birthing and postnatal care of the mother. So the mother will actually develop a relationship with the midwife and educate her and hopefully be there for the birth of the baby. Well, as a midwife's perspective, I think it's a wonderful opportunity, this new group practice for maternity, and I think that'd be really exciting if there's any midwives out there interested moving to a country area.
It's certainly a lot easier and a lot cheaper to live here than it is with my friends that live in Castle Hill and various places like that in Sydney. I'm lucky enough to be 4 or 5 minutes away and yet live out of town and can stand on my veranda at night and just see the stars and not see any neighbours' lights, so it's ideal.
Leeton has got a whole range of different allied health positions. There's physios, occupational therapists, dietitians, speech pathologists, counsellors, there's so many. The beauty of a small town like Leeton is the diversity of opportunities. So you're not just channelled into one particular group. You might be working in acute in the morning and aged in the afternoon, you might be out in the community, or you might be travelling to one of our smaller outpost areas.
So some opportunities that I've been lucky enough to be granted with while I've been working here at Carramar is the chance to have ongoing training and support while doing training as well, and personally for the flexibility around my study. And then I will like to go on to do my registered nursing. In summer, I like to go out to the river, skiing, fishing, sports. Sports is a big thing here. If you want to go away on a holiday or a little weekend away. Narrandera is 15 minutes away and there's an airport there. Just jump on the plane and off you go.
I love my job as well, which this is the job that I hoped I would be doing when I was a university student, so it's worked out quite well and not a lot of people can say that, so I'm pretty lucky. I think there's a lot of things that are really satisfying about working in rural general practice. Because we're a little bit more isolated than you are in a bigger centre, you do take on a bit more of the more complex management. In rural general practice you get to know your patients really well. You know, it's not the sort of place where people drop in and see one doctor one day and see a different doctor the next day. I think patients really appreciate that, and look, I think it's just a great place to live.
We live very close to the facility, and so it's very easy to get to work without having the hustle and bustle of the city traffic that I was used to prior to coming here. And you just enjoy the country hospitality. And to anybody who is considering coming to the country and working as a registered nurse, there are lots of opportunities for growth.
You're supported really well through different initiatives. There's mentors, there's professional advisors, there's lots of education being run via Skype. We use a lot of telehealth to ensure that support networks are available to staff. Look, it is a fantastic opportunity to build your autonomous skills, but in a supportive way. It's wonderful. You'll drive 2 minutes and you're at work. You've got beautiful community members. All the staff are very supportive, and it's just a wonderful place to work.
I think anyone that's interested in being a well-rounded general practitioner or a well-rounded doctor, who's interested in looking after their patients with a degree of continuity of care and who wants to continue to develop both their acute and chronic management skills, I think any rural town's a great place to work. Obviously I'm biased to Leeton. Look, I think that it offers wonderful opportunities for a terrific career, and a career that not only is very satisfying for you but that's really appreciated by the patients and the community as a whole.